I see the faces are very tired. And I'm also tired. You could imagine the difference between my country and over here almost 10 hours. I'm supposed to be very deep sleeping now back home. So I try to resist myself. So I try to, as much as possible, to be quick and to make it interesting so you could wake up a bit. Okay, let me just introduce myself. My name is Salah Al Awaidy. I'm a pediatrician and clinical epidemiologist working in the Ministry of Health. And I've been, for the last 5 to 6 years, I've been focused on clinical epidemiology and to be a pediatrician. I found it very interesting to work in epidemiology. And what I will be doing today is try to share with you our experience on influenza H1N1 pandemic, the Oman experience. And the most important thing about this is not telling you what we have observed, but the most important is the experience, the lesson learned, because we are living in the world that, at least I could say for the last 15 years, we've experienced a number of outbreaks. Let me just remind you, from 2003, we have experienced SARS in some of the Asian countries. And then within a few years, I mean, I could say 1 to 2 years, we experienced an avian influenza, and then followed by the pandemic H1N1, which most of us have experience with, and it was quite devastating. And then followed by another outbreak, maybe was not a pandemic, but is considered as important, MERS-CoV, and then Ebola, and now we're facing Zika. So you could look at the period between one problem to another is very short, and hardly you could pick up one thing and then there's another thing is coming over. So the idea behind it, we as a country, you need to be so ready to, to cope up with all these pandemics and problems. It was really interesting yesterday night to hear from the CNN how the in charge of, I don't know what you call it here in U.S., in Atlanta, talking about Zika. They are really afraid of having Zika in Atlanta. So I said, wow, look at that. So these diseases are very much, keep moving from one place to another very easy and very rapidly. Well, so what I'm going to do is I'll try as much as possible to make it simple. So I'll be touching upon a bit of background, how we have settled the system of surveillance system, pre-pandemic phase, pandemic phase, and post-pandemic phase, the vaccination strategies adopted, the cost of pandemic, which is quite interesting, the impact on health system, and lesson learned, and finally the conclusions. Well, for those who do not know where I'm coming from, this is where I'm coming from. Oman is located in the east, in the southeast of Arabian Peninsula, and we are bordering the United Arab Emirates. I think everybody knows Dubai. Dubai is a very famous place. And we are bordering Saudi Arabia and Yemen, and we're facing, the Arabian Sea and Indian Ocean. We have a long coast facing oceans over there. And just for me, interesting to look over here, this part of the world becoming one of the very, very important hub for most of the people roaming around the globe. The Emirates? Emirates having almost, for example, 3 or 4 flights to Rio, and all these flights are full daily, 3 flights, and each flight is around 700 people. So you could imagine the amount of movement from this part of the world to any world. We have around direct flight from this part of the world to US. At least around 10 to 15 flights across many places. So the movement is so amazing. The idea to say so that, we are living in an area where it's considered to be, we consider as very hot, and anything could happen. So we need to be so ready to handle any sort of outbreak or pandemic could happen anywhere in the world. Okay, so With respect to pandemic influenza H1N1 that took place in 2009, the pandemic, in fact, took place after almost 40 years of the last pandemic of flu took place, which was in 1964, so almost 40 years. It was, I don't know whether it was really silent or there was an outbreak, but was not identified. This is something that need to be think about it. Anyway, we in Oman was the first pandemic we have dealt with as a pandemic. Maybe earlier on was no system was in place, so, but we consider this is the first pandemic. So a lot of lessons that we have learned from this pandemic and to strengthen our system in order to how to deal efficiently wherever the upcoming problems. So before the pandemic, we had a number of surveillance systems in place. These surveillance systems we consider as early warning system that really could help us to identify any sort of influenza pandemic. So we had influenza-like illness in surveillance in place. We had another one, laboratory influenza surveillance, over virological surveillance in place in surveillance. So these were two surveillance sometime before 2001 in place, and they will really provide us a lot of good information about influenza activities in our country, and were really real-time monitoring. And this is sort of data that we're collecting that really provide us. And most of these surveillance are taking place in a primary health care, which is, available across the countries, and very good system that is already in place. After the SARS, which took place 2003, we realized that we were capturing most of the cases in outpatient or primary care, but we're not capturing any cases at the hospital. So we have established a surveillance system, sentinel SARI, called SARI, which is severe acute respiratory infection surveillance in some of the hospital, capturing all the cases, pediatric as well as adult cases, looking. And these cases, we not only identify them, we take samples, and then we really screen them to all type of influenza. And we found any sort of sample that which is not typable or rarities, we send it abroad to be looked into any novel viruses. Well, and this is sort of data that we have collected that really looking at the seasonality and the trend over time, and looking at the age group also, and you could see that in the majority of the cases that we picked up were among the pediatric age group. I'm going to come back to this in a minute. So what are activities that we have done during the pandemic? As I've already said, the pandemic H1N1, influenza H1, was the first pandemic as considered as a public health in Oman. And what we have done, the first thing is try to as much as possible to make it more timely and getting the information timely. So we have further tried to get all the data of SARI in daily basis, as well as data to capture as much as possible what's going on with respect to H1N1 in our country, and try to simulate all the system that have been part of the pandemic preparedness in our system in order to vigilant tackle the problem. And this is just to show you what are the different systems that we have in back home in terms of how we handle the pandemic in the different task forces. Okay, in addition to that, we have already established what we call shock centers, surveillance at point of entries, circulars, and so forth. These are the things that we have made it actively involved with in order to make the system more efficient and everybody being involved. And these are the assumptions, the planning assumption for the pandemic during the first wave, and we estimated what would be the clinical attack rate, preclinical attack rate, hospitalizations, and everything, because this was really a sort of background to us to figure out how we're going to handle the pandemic during the first wave of the H1N1. And we have started screening the patients in Oman sometime in June for H1N1. And this is the epi curve that we've started. So we have started pick up the first few cases of H1N1 sometime in the third week of June. And as we going along, and picked up sometime in August. That was very much as a result, as would we assume, of the opening of a lot of these private schools, and then we had a bit of dipping of the cases, and it picked up again after opening all these government schools that really, make it the pandemic or whatever the outbreak that we had it over there more exaggerated because of the opening of the schools. And this is showing, not only showing, this is the cases of the black one, the case of H1N1. This is the IL cases that we picked up in outpatients, and this is the inpatient cases, and this is the deaths that associated with H1N1. As you could see, so we had the first peak over here, and we had a higher peak sometime in November, and very much in line with the cases that we were seeing in outpatient, as well as the deaths and increasing of inpatient as well that we have experienced in our hospitals. And the pandemic ended up sometime as you see over there, in February 2010. That's the time that we've seen a bit less cases that's taking place. In terms of the age distribution, the mean age was 24, and we have seen the cases from 28 months the range to 74, and you can see majority of the cases were between 5 years to 40 years. That's the majority, but the majority of the cases were within 12 years, 25 years of these cases. And when you look at what type, during outbreak we had, apart from H1N1, we also had another, the viruses circulated, which is the flu, other flu viruses, which is almost half, 50% of others were due to H1. These are that represent the 46% over here, H1, pandemic H1, and this is the seasonal H1N1, and others were flu A. So we had a mixture of cases as a result of pandemic over there. Well, what we have also observed that we had most of the cases took place in the capital area and followed by other governorate, but majority are taking place in the capital area, which is Muscat, and these some of the symptom and sign that we had it, which is mostly, I think, the same symptom that already experiences most of the countries globally. And interestingly, that we had overall, the highest case facility took place in one of the governorate, and it was very interesting to see why this is happening over there. But when we went in depth of that, we have seen that majority of these cases, in fact, were pediatric age group between 5 years, 5 years to almost 12 years, which is very, very interesting. We try to explain why this is happening, particularly in that particular region, particularly compared to other regions which they had a much lower fatality rate, and we couldn't find a very obvious explanation for that. And overall, national average death rate was 1.2 per 100,000 population, which is considered to be a bit lower compared to other countries where they had a much higher national rate for among the attributed cases for H1N1. Well, we can see when we were looking at comorbidity, we had out of those death cases, we had almost, I could say, 43% were very much related to comorbidity for one reason or another, and others, unfortunately, we had deaths among pregnant women, and then we had the smokers and obesity as well, which is globally. So with respect to vaccination, initially, when we are planning for the vaccination, we are assuming, because it was high demanding across the country, so we were assuming that every individual person has a right to take a vaccination. So we planned for almost 3 million. It means almost all the population would have definitely been received the vaccination. But unfortunately, the reality was quite different. Apart from the people going to Hajj, which was a sort of mandatory that they need to take the vaccines, hardly the other groups, for one reason or another, they refused to take the vaccines because of a number of rumors that were really highly circulated at that particular time in our part of the world. So the overall coverage, we were assumed that to be high, but unfortunately we had 1.3, and very few of a high-risk group, for example, pregnant women, other children, and pediatric age group and so forth, that we really wanted to take the vaccine, unfortunately. And this is what really a big West, because we've lost a lot of money as a result of this sort of, low uptake of vaccination among our age group. Well, impact of this pandemic, we had, in fact, a high turnover of outpatient turnover, and this has really burdened our system in a way that really compromise other problems that we're facing in our system. It disrupted the routine appointment, and we have one other problem that most of our ICUs were really, really packed. And we have reached a level where we don't know how we're going to handle all these cases of that really needed to be in ICU, both pediatric age group and adult age group. That was really big dilemma. Shortage of ward requiring ventilation support, overburden of lab with the sample, shortage of reagents. So we had a lot of these problems that really impacted as a result of this pandemic. And overall, this is just showing you the overall cost of influenza. We have estimated the direct cost around 50 millions. But when you look at the really cost, it costs, we estimate it to be 3 to 4 times than more compared to the 50 millions, because this is a direct one. But indirect one is so huge, it's impossible to calculate it. Well, what are the lessons learned? So what we have learned over time, the number of things that we have learned is, most of those days we used to have all these plans in place, written very well, but we haven't really practiced them. We don't know, but the reality is totally different when you have all these things in a place. So now we look at these plans totally different. They need to be, to be lively looked into. So we undergo a number of these simulation exercises to make sure that really in place. Even this simulation is not enough. But I think the reality, what we had in H1 is really make our system say, whatever you write it down, but when you come to reality, make sure that everything is really in place. All these responsibilities in the different levels were really, really in a mess. And particularly in the private sector, we were not very satisfactory, and communication and so forth. So these are some of the key lessons that we have learned from these sort of a pandemic. One of the key is most of the time that we have handled the pandemic, it was like the Minister of Health is the one have to handle the pandemic, which is so wrong, that other ministers should also be part of that. And that is something that we have learned, and a lot of action had been taken according to that. So in the post-pandemic period, we have we've tried to strengthen our surveillance system as much as possible. We have created what you call National Health Emergency Response Plan, or center, physical center over there to do the job and to be the Minister of Health, and a national strategic framework for the medical and public health response was established across the country. This is something that, if we're going to have, so later on when we had, for example, MERS-CoV, it was dealt differently than what we have dealt it when we had H1N1. It was not one body responsibility, it was across all the bodies that had the responsibility of tackle it and put it in place. So in summary, what I could say that the pandemic highlighting a lot of these drawbacks in our system, but more importantly that we believe surveillance, we believe that it was good, but need to be more strengthened and look at the different age group in more vigilant way. And we have also look at impact on the healthcare system as a whole and varied from low to severe, and every aspect of the pandemic from in how we handle in our hospitals, how we have done it was very much looked into. Now we're very much better in looking at this. But more importantly is now we're in a much better situation in handle more efficiently in any sort of future pandemic. For example, when we handled the MERS-CoV, this is one of the countries that we are having cases, but we haven't had any sort of nosocomial infections compared to other countries. We never had. We have so far, every year we do have 3 to 4 cases, and we never have any hospital nosocomial infection. We never had that compared to other countries. So all of that has really helped us to really handle more efficiently and be more vigilant in handle these sort of problems. I think by this, we're publishing our work already in one of the journals. So if somebody is interested to read the detail how we handle and how we documented all of that. By this, I would like to thank all of them. And this is shukran. It means in Arabic, in English, thank you so much for your attention. You're already exhausted. Just given one of the very interesting experience that took place in Jordan, how the MERS-CoV were, you know what's MERS-CoV, right? MERS-CoV. You know that? You know, okay, everybody knows about that, okay. This is what we usually do in that. You know, if you have a case admitted in ICU, for example, or a case admitted that have respiratory infection, that have abnormal with the presentation, everything, of course, all of these, they're coming under the surveillance. We take the sample. But nowadays, with all the experience that we had we preserve these samples. This is exactly what happened in Jordan, because Jordan was the first country, they preserved the samples for almost 6 months. And when the first case was identified in Saudi Arabia, they went back and picked up those samples when they screened them and found that those samples really, but the tricking thing is that, if you have somebody who is, for example, adult, was fine without any comorbidity and have something that hit it with the respiratory with very much unusual. Nowadays, what we usually do is we send samples abroad, automatic, because we don't have all the techniques to go into analyzing all the sophisticated. So that's something that we have learned a lot from our both pediatric and adults. We send in sample abroad, say, would you mind look at it and try to preserve and send it abroad. The idea is we don't know. This novel virus nowadays is easy, they could come up anytime and in any sort of
It's just that the bronchoconstriction that's associated with the viruses, they are actually more deadly than asthma. And they are widely underestimated and overlooked in ICUs. For instance, I was just around Thabit, and we had a patient who was on ECMO, and he had H1N1. And so we ascertained, the patient had peribronchial thickening of the airway. Yes, be positive for H1N1, yes. But the attending didn't believe that was the reason that this patient was on life support and on ECMO.
Okay.
So,
Interesting. Yes, please.
In terms of prevention, have you in some way immunized your population? What's the age you use?
The flu vaccine? Yeah, flu vaccine is already available, free of charge to everybody, but it's not a mandatory.
Do you anticipate more or less what strain you're going to have lined up?
Yeah, that's why we have that virological, so we know our seasonal circulating vaccine. We are absolutely aware of that.
From what age to what age do you have?
From we give 2 years onward.
Here we start at 6 months.
6 months, okay.
Much more patients that have comorbidity. They get to be vaccinated.
Yeah, 6 months, okay.
so as you do your counts and your panels go, like from 8 to 1 through 8 or something like that, and it's 1 through 3 or whatever. And so the question is that the virus goes up or down the panel. Is your vaccine still effective?
Yeah, well, last year, based on the vaccines, flu vaccines, ingredients, I think we were covering almost 40% of what is circulating vaccine. Almost 40%. That means 60% whatever circulating is not covered by the available vaccine, flu vaccine. Absolutely. That's very low.
Have you used antiviral medications during this epidemic?
No, we haven't used anything, no. For our patients? No, we haven't used anything.
We have a similar type of epidemic in the States, and we're able to use antiviral medication with some type of...
Now, during the pandemic, no, but now, yes, we do have, yes. Now we do have, yes. But during pandemic, no. It was not available. I mean, during the demand of these vaccines and everything, it was so huge globally. And even if you have money, the company, they will tell you, sorry, we don't have a slot for you. So this is one of the lessons that we have learned, that you need to have this, you need to plan quite ahead of time for the vaccines, whatever it is stockpiling and everything, all of that. That's why one of something that we have learned, and every day we keep planning things. Okay.